So it turns out the brain is amazingly plastic, meaning it can change.
Just thinking about something we said earlier about how early childhood trauma causes the brain to change
hmm
and then results in addictive behaviors. If I went through an early childhood trauma and my brain has changed because of
hmm
that, and then I become addicted to alcohol as a young man, and then I manage to find my way off the alcohol,
hmm
my brain is still addicted, right? My brain still has that addictive sort of predisposition. So isn't it the case that I'll just end up being addicted to something else that gives me a dopamine hit?
So it turns out the brain is amazingly plastic, meaning it can change. We see that over time. So the first thing is even adverse childhood experiences are not a done deal. We don't talk a lot about PCEs or PCE, positive childhood experiences, but actually you can reduce the risk that someone develops addiction by increasing the number of positive childhood experiences. So take someone who's experienced some terrible adversity. Their parent has died, or they have a parent who's in prison, or they have addiction in their family. If that kid has one single adult figure that they believe cares about them, that reduces their risk of addiction. There are a lot of positive ways that we can actually change the trajectory, even in the midst of terrible trauma. When you think about someone who's had a substance use disorder, we actually have good data on this that after 5 years of recovery, and often that is fits and starts. So most people think of like this is one fell swoop that you like decide to stop drinking and then success is that you never drink again. For most people, what we find is that's actually like a series of steps. So I always like to think of progress, not perfection, and not have this kind of all or nothing mindset that for many people, they may early on have a month where they go without alcohol, and then maybe next time it's 3 months, and then maybe it's a year. And these recurrences happen, but ultimately they get to this place where they go into long term recovery. After 5 years of recovery, a person's risk of subsequently developing addiction is no higher than the general public. So your brain actually does change. And we see this on functional imaging. We see this in longitudinal studies that follow people over time. You actually can overwhelm those things and get to a place where you don't have a higher risk than other people.